Hi guys. Okay, it's finals week. ATIs are happening. You've got a lot on your plate. We're still social distancing. Things are still crazy around the world in the United States. Lots of stuff is going on. I wanted to give you a very quick video about something that I have noticed I've been talking about a lot more with students as we do practice questions together. And I don't think I've ever made a video about this, so I really wanted to get it out there so that you can really know that this is helpful. So when you are doing your test questions and when you are reading your answer options, I really want you to hone in on things that are describing something that don't necessarily need a description. So for example, you have a question talking about your patient, whatever the question's talking about, but it says the patient states or the patient has. That's very broad. There's no description about your patient. So if instead your question says your 3-year-old patient, I've just changed and flipped the script on the whole thing, because now I'm talking about a toddler, and a toddler has different developmental, different safety things. So I have to be very careful on choosing my answers. There is probably going to then be an answer that pertains to a toddler that I should be very aware of, or that answer option probably doesn't go with a toddler and I can eliminate it. So it can go for female, male patients, geriatric, any age range of patients. It can go into religious things like the type of religion your patient is. If they tack in some sort of religion, your patient who practices whatever religion, they're describing that person, and there is going to be an answer option that pertains to that religion, or it doesn't pertain to that religion. Or maybe some habit about your patient. So maybe your patient who eats a certain way, who has certain dietary restrictions for that, eating pattern. So it can go for patients, it can go for disease processes. So if they say your patient with renal failure, okay, renal failure, it's generalized though. But if they tack in your patient with chronic renal failure or your patient with acute renal failure, something is different now. Something is going to either pertain to that being acute renal failure, if you're talking about acute renal failure. One of your answer options maybe doesn't go with acute renal failure, maybe it goes with chronic renal failure. So it's really important to identify adjectives. Adjectives in the question, adjectives in your answer options. If you haven't been focusing on this before right now, when you go after this video and you start doing practice questions, you literally will see descriptors everywhere. I want you to be Magnum PI and start looking at your test questions and your answer options with a different lens and see how many descriptors you can find and see how those descriptors make you want to choose an answer or make you not want to choose an answer. And then you'll be able to use your process of elimination with your nursing knowledge to make more educated decisions during those exams. I'm so proud of you. Keep up the good work. Email me if you need me. I'm doing Zoom appointments, so just hit me up if you need me. I'm so proud of you guys. Hang in there. You've got this. Bye.